We live in a changing world of high technology in which emergency response personnel must be prepared to deal with an ever-increasing variety of accidents. Responding to hazardous material accidents is a special challenge for emergency personnel. Safety of both the public and rescue personnel depends on education, planning, preparation, and practice. Radioactive materials are one kind of hazardous material, and response to an accident involving these substances is similar to any hazmat response. Although radiation accidents are rare, uses of radioactive materials have increased in recent years. Radiation accidents can occur in industry, university laboratories, nuclear power plants, during the transportation of radioactive materials, and in hospitals. The purpose of this presentation is to acquaint emergency personnel with the procedures needed in dealing with accidents involving radioactive materials. Two general kinds of radiation accidents can occur. The first kind occurs when a person is exposed to penetrating radiation from X-ray equipment or to gamma rays from highly radioactive materials in sealed containers. In such a case, the irradiated person may suffer medical consequences if the amount of radiation is very high, but he is not radioactive or contaminated and does not present any danger to others. The second kind of radiation accident occurs when radioactive materials in the form of gases, liquids, or solid particles is accidentally released into the environment. If the radioactive material gets on a person's clothing or skin, he is said to be contaminated externally. If the radioactive material is inhaled, ingested, or absorbed through wounds, mucous membranes, or the skin, the person is said to be contaminated internally. Any accident involving radioactive materials may result in irradiation, contamination, or both. Radiation cannot be detected by our own human senses, but can be readily detected by radiation monitoring devices. As in all emergency medical situations, the first priority is rescue and life-saving care. While the hazards of radiation should be respected, knowledge of simple protective actions will allow you to safely administer emergency medical care and perform victim rescue. Several protective actions are useful in preventing or minimizing irradiation or contamination. Spending less time near radioactive materials means less radiation received. The greater the distance you can stay from a source of penetrating radiation, the less radiation received. Also, penetrating radiation can be reduced by shielding with solid materials. The greater the amount and density of material between you and a source of radiation, the less radiation received. Shielding materials may include vehicles, walls, or piles of dirt. However, shielding is not always practical during emergency field operations. Finally, the lower the quantity of a specific radioactive material in an area, the less radiation. Your goals will be to stabilize and rescue the radiation accident victim using these protective actions to reduce radiation exposure levels and to prevent the spread of radioactive materials on the victim, yourself, and in the environment. 3 cases will be presented to illustrate these and the other important points in emergency field response. In the first case, an industrial radiographer is preparing to check some pipe wells. His equipment includes a very strong source of penetrating gamma radiation. Accidents involving industrial radiography units have in the past caused the greatest number of radiation injuries. The radiographer is getting ready to take a picture called a radiogram of a section of high-pressure pipe. The technique is similar to that used in obtaining an X-ray of the chest, although the radiation is much, much greater. The radiation source is cranked out of the shielding to the area to be radiographed. A crank and cable is used to move the source through the guide tube, which provides little shielding from radiation. The source position is indicated by the arrow. If you could see the source, it would be similar to the one demonstrated on the screen. In this case, the radiographer has trouble with the crank and is injured by falling pipe while checking the connection.
In 501.
501.
Emergency traffic to 14th and Leonard. Man injured in fall. Be advised there may be radiation present. Civil defense has been notified.
10-4. We'll need our survey meters and dosimeters. Oh, he's over behind there. Okay. I've got positive reading. I believe it's coming from that thing over there. Okay. Hey, fella. Hey, you hear me? Huh? Let's stabilize him and get him out of here stat. Is he breathing? Good. Is he conscious?
No. He's got a little head injury here.
We better go ahead and treat him for neck or back injuries. I'll go ahead and get the scoop stretcher and cervical collar.
Once life-threatening and spinal injuries have been evaluated and treated, rescuers move the victim away from the potential areas of radiation exposure for secondary treatment. These quick actions reduce radiation exposure to both the victim and rescuers. The shorter the time in the radiation area and the greater the distance from the source of radiation, the less radiation received.
I'm not getting anything above normal background readings now, so there's no contamination.
The rescuers have found that the patient is likely to have only been irradiated and not contaminated by radioactive materials. Therefore, continued treatment and transportation can be accomplished as usual, since irradiation presents no immediate signs or symptoms or need for treatment in the field. The patient poses no radiological hazard to anyone. The rescuers make no attempt to handle the radioactive material. The area is secured, access doors locked. Expert help is available from your local or state radiological health department. In the second case, members of an emergency response team arrive at an accident scene where fire and radioactive materials are involved. Their first step should be to visually survey the site, being alert for the presence of any hazardous agents. Distinct signs, labels, or placards usually indicate the presence of radioactive materials. The arriving emergency teams position their vehicles upwind and alert their communication center, which in turn notifies the appropriate radiological health office. The primary responsibility of the first emergency team on the scene is rescue of trapped or injured personnel. Standard bunker gear is adequate to prevent internal or external contamination and should be worn. Turnout gear will not stop penetrating radiation. The decision to use protective breathing apparatus is based on the presence of smoke, fire, fumes, and other non-radiological hazards. Fire rescue personnel move the victim to the control line, where paramedics administer care. The paramedics wear gloves to prevent contamination of their hands. While emergency medical aid is administered, other personnel, as soon as available, isolate and secure the area. The hospital should be notified promptly that a possibly contaminated patient is to be transported. A checkpoint should be established between the controlled and non-controlled areas where monitoring and disposal of contaminated items takes place. Dosimeters are read and values recorded. This checkpoint should be convenient to where patients are transferred from the contaminated to the clean area for transportation to the hospital. Contaminated outer clothing is removed in the control area prior to transport if the victim's medical condition permits. The clothing should be placed in a labeled plastic bag. Removal of contaminated clothing reduces radiation exposure to both victim and attendants. Personal privacy should be respected if feasible. The victim is transported in a manner that prevents the spread of residual contamination. The ambulance cot is placed in the clean area and blanket or sheet spread over it. The victim is then assisted to the cot and the blanket or sheet overlap to package the victim. The victim and covering are then secured in the appropriate manner. Paramedics now remove their gloves and transport the victim. Remaining personnel and equipment cannot leave the contaminated area without being monitored for radioactive contamination. All contaminated equipment, unless needed for patient care, remains at the accident scene inside the controlled area. These actions help prevent the spread of contamination beyond the immediate area. Security personnel remain until expert assistance arrives to perform a complete radiological survey and initiate any needed site decontamination. The final case will demonstrate appropriate actions when the treatment of life-threatening injuries is complicated by the presence of radioactive material. Arriving emergency responders position their vehicles a safe distance upwind of the accident area. While ambulance and fire personnel prepare to enter and make initial assessments, a visual survey can determine if hazards such as fire, fumes, dust, or a mixed hazard cargo exist. If immediately available, protective clothing such as standard bunker gear should be worn. However, coveralls, raincoats, jackets, and other clothing to cover bare skin can also be used. Surgical or disposable plastic gloves can be used while treating injured victims. The decision to use respiratory protection is based upon non-radiological hazards or individual preference. Use your best judgment, but do not delay life-saving first aid if protective clothing is not readily available. Survey meters are recommended for initial entry. Emergency medical responders determine if injured victims are present and initiate life-saving care. As with any accident, the airway, breathing, and circulation of the victim are immediately assessed. Precautions are taken for possible neck and back injuries. In the absence of any airborne hazards, paramedics remove their respirators. While medical attention is addressed, fire personnel recover the shipping papers.
Get the papers.
Perform routine duties, including foaming for spilled fuel and the establishment of a control line. A checkpoint is established where personnel and equipment pass into the controlled area and radiological monitoring takes place. As a precaution, shipping papers are placed in a plastic bag for contamination control. The shipping papers remain at the command post so that radiation health, fire, and emergency preparedness personnel can more fully assess on-site radiological hazards. While police personnel assist in crowd control, the command post notifies the hospital that a contaminated victim is to be transported and identifies the radioactive material stated on the shipping papers. The hospital will need time to prepare their staff and facility. The identity of the radioactive material can aid in the medical decontamination decisions.
Where do you hurt more than anywhere else? Huh? Back of your head? See where you knocked out? Yeah. See your eyes? See your vision okay? Is it blurred or anything?
As the medical needs are being assessed, other personnel can make initial radiological assessments. Paramedics should be informed about the exposure rate in their immediate work area. Procedures involved in emergency rescue of such a victim are very similar to those used for fire or toxic chemical rescues.
This helps. You gave it.
What about your belly down in here?
It's a little bit sore.
For example, a hazardous material blanket or salvage cover may be used to control contamination to both the rescuers and the victim. Equipment such as shock trousers, resuscitators, EKG monitors, and so forth can be used. If CPR is needed, it should be promptly administered, including mouth-to-mouth breathing.
time the platoon went anywhere?
Not,
As soon as possible, dosimeters are assigned to rescuers caring for the injured.
really sure.
Where at?
Uninjured accident victims are moved to the control line where their clothing is removed. They are wrapped in a sheet or blanket and await transport to the hospital. Radiation itself does not cause unconsciousness or immediate visible signs of injury. Therefore, if the victim is unconscious, look for reasons other than radiation. Life-threatening problems have priority over a radiological assessment. Emergency first responders can safely adapt their usual routines to meet the needs of the radiation accident victim. If IVs are needed, the usual procedure of venipuncture is used. If possible, do not start IVs in areas of high skin contamination. Prophylactic IVs are not recommended. Medical assessment of the injured victim continues during rescue and extrication procedures.
No, just sore. It's just sore.
Extrication equipment, such as the airbags demonstrated here, is not affected by radiation. Cribbing is used for added personnel and victim protection.
Hey, partner, we're getting ready to get you out of here. Put you on this board in case you have bad here. Hey, we got traction up there? Okay.
When the victim has been extricated, he is moved to the control line for continuing care, radiological monitoring, and preparation for transport to the hospital emergency department. Wounds are covered with sterile dressings. Clothing is removed in order that injuries can be fully assessed and to remove as much contamination as possible. No other decontamination is recommended. The ambulance cot is brought to the control line and prepared for packaging the victim. A clean blanket or sheet is spread over the cot. The victim is then transferred to the cot and packaged to prevent the spread of any contamination. Anti-shock trousers are also shown here. Patients needing continued assessment en route to the hospital or those with IVs should be wrapped to allow easy access. If available, the victim is transported by an ambulance crew that has not been in the controlled area.
Medic 40 to Medcom.
En route to the emergency department, additional information is relayed regarding the number of patients, their condition and medical status, and estimated time of arrival. If known, the extent of contamination and any suspicion of internal contamination may be relayed. The ambulance crew should also ask if there's a designated entrance to the emergency department for contaminated cases. Back at the accident scene, rescuers should follow a set protocol. They should remain in the controlled area. Outer clothing is removed at the checkpoint where a complete radiological survey takes place. If any contamination is found, decontamination of rescuers is directed by health physics experts. If health physicists are not available, contaminated rescuers are packaged and transported to the hospital for decontamination. Upon arrival at the emergency department, the ambulance will probably be met outside the emergency entrance by the emergency response team. Patients will again be evaluated at this point and admitted for emergency care.
You hear that?
Got a little place right here that seems to be contaminated.
The usual medical report is given as well as information regarding the radiological status if known. Unless needed back at the accident site, the ambulance crew bags contaminated sheets, secures the ambulance cot and transport vehicle, removes their gloves and receives a radiological survey. If they must wait for a complete radiological survey, they do not leave the controlled area. In the meantime, they should not eat, drink, or smoke. The ambulance crew and their equipment can return to regular service only after having been monitored and decontaminated if necessary. Disseminers are left in the charge of the hospital health physicist. As a matter of precaution, a shower and change of clothing is recommended for ambulance personnel. Simple isolation precautions and contamination control techniques can prevent the spread of radioactive materials, while time, distance, and shielding can reduce radiation exposure to accident victims and rescuers. The radiation accident victim is never denied life-saving emergency medical treatment because of fear about radioactivity. Necessary emergency medical treatment should not be delayed by attempts to measure levels of radioactivity. Detection alone is adequate. Field decontamination of radiation accident victims is usually limited to removal of clothing, since flushing or brushing may spread contamination. The procedures involved in emergency rescue and transport of the radiation accident victim are very similar to those used for fire rescue or where hazardous materials are involved. Perform rescue and life-saving treatment as soon as possible. Spend as little time as possible in the hazardous area. Stay as far as practical from heat, flames, toxic chemicals, or radioactive materials. Wear protective clothing if available. Take advantage of shielding. Do not eat, drink, or smoke. And set up control lines while staying upwind of the accident area. By employing these procedures, emergency personnel can adequately care for the needs of radiation accident victims while affording maximum protection to themselves and victims alike.